There's a reason why your body sends signals, and yet so many people ignore them, especially when it comes to gut health. But the truth is, those subtle discomforts you've been brushing off might be warning signs of something much more serious. Colon cancer, one of the most common yet under-discussed cancers, is often discovered too late. But with the right awareness, you can recognize the early symptoms and take control before it's too late. Let's begin with the symptom that many dismiss as nothing serious: abdominal pain. Yes, stomach cramps can be caused by indigestion, gas, or something you ate, but that's not always the case. When colon cancer begins to grow, especially in the rectal area, it can press against nearby tissues and cause sharp, intermittent pain. If you've never experienced abdominal pain before and suddenly feel intense cramps that come and go, it's not something to ignore. This pain may become more noticeable during bowel movements, especially if the tumor is located low in the rectum. You might feel a strange discomfort when you go to the bathroom, as if something is in the way. While dietary changes like increasing fiber can cause gas, if your eating habits haven't changed but the pain continues, you should pay close attention. And if that pain comes with bleeding, unexplained weight loss, or shifts in your normal bathroom routine, don't wait. Seek medical advice immediately. Now let's talk about another sneaky symptom: fatigue. Everyone feels tired now and then, right? But what about fatigue that just won't go away, even after rest? Chronic tiredness that lingers for weeks may be more than just stress or poor sleep. Colon cancer can cause slow, internal bleeding that you might not even see. This hidden loss of blood can lead to anemia, a shortage of red blood cells, leaving you feeling weak, pale, and completely drained of energy. Even more concerning, cancer cells are energy hungry. As they grow, they steal nutrients and fuel from your body, altering your metabolism and sapping your strength. If you feel persistently fatigued despite eating well and getting enough rest, don't dismiss it as just getting older. There could be something deeper going on inside. Moving on, let's focus on a more visible but still commonly ignored sign: changes in your bowel habits. Everyone's routine is different. Some people go once a day, others less often. But what matters is recognizing when your personal pattern changes. Are you going more often? Less? Are your stools narrower than usual? More firm? These differences matter. About 65% of people diagnosed with colorectal cancer report noticeable changes in their bathroom habits. Narrow, ribbon-like stools can suggest a blockage in the colon, perhaps caused by a growing tumor. Hard stools might point to constipation, but if this is new and not related to a change in diet, it's worth investigating. Subtle shifts in shape or frequency are often the body's way of flagging internal issues long before pain or discomfort sets in. Next, we need to talk about bloating. Not the kind that comes from overeating, but persistent, unexplained swelling in your abdomen. When a tumor starts to block part of your colon, waste and gas can build up behind it. This leads to a full, tight feeling that doesn't go away, even after a bowel movement. It may come with discomfort, pressure, or even visible swelling. The mass of the tumor itself can press on nearby organs, increasing this sensation and making digestion more difficult, especially if bloating appears alongside other symptoms, like changes in bowel movements or fatigue. It's time to act. And here comes one of the most alarming signs: blood in your stool. It's never a good idea to ignore blood in the toilet or on your tissue. While it's true that hemorrhoids or certain foods, like beets, can cause red coloring, consistent or bright red blood is a major warning sign. Depending on where a tumor is located, the blood might appear differently. Tumors in the ascending colon, right side, may cause dark, tar-like stools, a result of blood being digested before passing. These are often harder to spot, but smell noticeably bad. On the left side, where stools are firmer, bleeding is more visible and may appear as fresh, bright red streaks in the bowl or on toilet paper. The tricky part is that sometimes people chalk this up to hemorrhoids or fissures, but assuming it's nothing is a dangerous gamble. If you notice any kind of blood, it's critical to get checked, especially if it happens more than once. Let's now explore another unsettling indicator: unexplained weight loss. If you haven't changed your diet or exercise habits but you're dropping pounds rapidly, your body may be struggling with something serious. Cancerous tumors can alter how the body processes energy, often stealing nutrients or increasing your metabolic rate. Some substances produced by tumors like TNF-alpha or interleukins suppress appetite or increase inflammation, leading to weight loss. If you've lost 5, 10 or more pounds without even trying, and especially if this comes with fatigue or abdominal issues, it's a big red flag. Weight loss, caused by a serious condition like colon cancer, doesn't just reduce fat. It also eats away at your muscle mass and overall strength, leaving you feeling frail and off balance. Finally, we arrive at a deeply unsettling but common symptom, tenesmus, the constant feeling that you still need to go even after you've already gone. Imagine using the bathroom and still feeling like something's left behind. Not just an occasional sensation, but a nagging, persistent discomfort. This can happen when a tumor partially blocks the rectum or distorts the space where waste collects, creating a false sense of urgency. You might push, strain, or sit longer than usual, but relief never comes. It's not just uncomfortable, it's your body telling you something's wrong. And here's a chilling truth. Many people with colon cancer don't feel any symptoms in the early stages. That's what makes this disease so dangerous. The silence doesn't mean you're safe. It means you need to be vigilant. Understanding your risk factors and pursuing early screenings can make all the difference. We've talked about the symptoms, but now let's look at what could be happening silently inside your body. Polyps. These small growths in the lining of the colon are often harmless at first, but some have the potential to turn deadly over time. It's estimated that it can take around 10 years for a polyp to develop into full-blown cancer. That's both good and bad news. The bad news? It can creep in slowly, without symptoms. The good news? If caught early, it's entirely preventable. That's why awareness and routine screenings are so critical. Polyps can be removed long before they become dangerous, but only if you know they're there. And here's the kicker. Colon cancer is being diagnosed more frequently in younger adults than ever before. This isn't just a condition for the elderly anymore. Your age does raise your risk, yes, but so do things like poor diet, low physical activity, smoking, and genetics. Inflammatory bowel diseases such as Crohn's disease or ulcerative colitis also significantly increase the risk of colorectal cancer. These chronic conditions inflame the digestive tract, causing long-term damage that can promote abnormal cell growth. Likewise, hereditary syndromes like Lynch syndrome or familial adenomatous polyposis dramatically elevate risk. If there's a history of colon cancer in your family, that's not something to ignore. Even something you wouldn't expect, like your height, has been linked to a slightly increased risk. While you can't change your genetics or how tall you are, there are many risk factors you can control. Let's take a look at them. First, consider your lifestyle habits. Smoking and heavy alcohol use are both well-established risk factors for colon cancer. But just as damaging is a sedentary lifestyle paired with a diet high in red and processed meats and low in fiber. These dietary choices lead to sluggish digestion, inflammation, and an unhealthy gut microbiome, creating the perfect conditions for abnormal cell growth. To stay protected, hydration is key. Drinking plenty of water helps your intestines stay lubricated and efficient, preventing waste from sitting too long and causing irritation. A high-fiber diet is equally critical. Fiber helps move things through the colon smoothly and feeds the good bacteria in your gut, your body's natural defense team. Antioxidants also play a role. These are found in fruits, vegetables, seeds, and spices, and they fight inflammation, protect cells from damage, and boost immunity. Turmeric and ginger, for example, are powerful anti-inflammatory agents that can be added to your meals easily. Swapping out processed snacks for colorful, plant-based foods could help reduce your risk substantially. Even dairy, often a concern for people with lactose intolerance, has shown protective effects in many individuals. Products like yogurt, cottage cheese, and certain aged cheeses contain probiotics and calcium, which can help fortify the colon lining. However, always be cautious if you have food sensitivities. And then there's exercise, perhaps the most underrated cancer fighter. Just 30 minutes of moderate activity a day can reduce inflammation, balance hormone levels, improve circulation, and help you maintain a healthy weight. Every walk you take, every stretch you do, it all matters. Now we must stress one last crucial point: get screened. Colonoscopies and other detection tools aren't just for people with symptoms. They're for anyone serious about protecting their future. Current guidelines recommend starting regular colonoscopies around age 45 or earlier if you have risk factors. This one test can catch polyps early, often before they cause any harm. In summary, colon cancer doesn't have to be a silent killer. You now know the red flags: abdominal pain, fatigue, changes in bowel habits, bloating, blood in stool, unexplained weight loss, and that unsettling sensation of not being able to fully go. These are not normal parts of aging, they're warnings. And combined with invisible dangers like polyps or genetic risk, they form a picture that's too urgent to ignore. Prevention starts with awareness. From what you eat and how much you move to when you get screened, each choice is a step toward protecting your health. If you've experienced any of these symptoms or simply want peace of mind, don't wait. Reach out for support, share this information with your loved ones, and take your digestive health seriously. Because when it comes to colon cancer, early action can save your life.